So, afternoon and happy Earth Day, everyone. I'm Valerie Wolf. I'm one of the executive directors at the Occupational Health Clinics for Ontario Workers. And today I'm very happy to welcome you to our 27th webinar in the series COVID, which is about the occupational aspects and prevention of COVID in workplaces and mostly to protect workers and, of course, the public that they often serve. Today is Earth Day, happy Earth Day, and we thought it was really important to seize the opportunity of the occasion to reflect on what's happening with respect to the pandemic, but what it means in a broader sense in terms of other challenges we face around the world, not just the pandemic, which we continue to be fighting, and climate change and wars and aggression and so many other things that we as a species and as a world are facing. So we're going to consider some topics quite broadly today, but the discussion always is what can we do about it, and what can we do about it to improve things in our workplace and in our communities and in our province and in our families and all that. So I'm very happy to welcome our three speakers. We're going to hear from Dr. Jane MacArthur, who's going to talk about COVID-19, a lesson on environmental justice. We're going to hear from Dr. Colin Furness, who's going to talk to us about trust and the noise of misinformation, which is a cacophony, as we talked about when we were considering the title, and then from Dr. Victor Leung, who's going to talk about the healthcare implications now and into the future, given all these considerations. So right now, I'm going to turn the mic and stop sharing and turn the mic over to Jane. Thanks.
Thanks so much, Val. And hello, everyone. Good afternoon. Happy Earth Day. I want to thank OCOW for inviting me to be a part of this webinar and for the opportunity to join the stage, so to speak, with two voices who have been pivotal to my learning and understanding through the pandemic. And thank you to everyone here today. I'll first give you a little agenda for my talk on COVID-19 through the lens of environmental justice. I'm going to talk about a little bit of my background and how I came to the problem of COVID-19 as an environmental justice issue. I'll define the term and talk about some of the principles of environmental justice. I'll use examples of research with healthcare workers and COVID-19 protections to illustrate some of the elements of environmental justice. I'll discuss the connection between air pollution and COVID-19. And I'll capture some of the elements of COVID-19 messaging and governance as an environmental justice problem and situate them within an ecological model. And then I'll conclude with some lessons from the pandemic to reinforce the problem and the need to see COVID-19 and other environmental and occupational health issues as environmental justice issues as a means to think about prevention. So in terms of my background, I've worked for 25 years or so on environmental and occupational health issues, whether through research, communications, or advocacy. And as a sociologist specializing in social justice, I'm trained to see the interconnectedness of our social and political systems with health and well-being. COVID-19, especially the denial that the virus was airborne and the disproportionate impacts on marginalized and vulnerabilized populations, has starkly illustrated what we've seen in environmental and occupational health struggles for decades, which is that governance very much matters to health. The implication that individuals are to blame for health problems has been exposed for its deep flaws as we've watched COVID-19 kill residents and healthcare workers in long-term care facilities, infect healthcare workers, disproportionately impact communities of Black and Brown people, hit migrant farm workers and precarious workers in service and retail, and interrupt our children's education, and so much more. The realities of the COVID-19 pandemic these last 2+ years have dominated much of our energy, advocacy, and action. It's hard to not be immersed in the daily news and realities of the pandemic, but I want to step backwards to the early days, weeks, and months of the pandemic to ground my presentation today. The pandemic began just as I was finishing the analysis of my PhD research with women workers at the Ambassador Bridge. They were suffering adverse health impacts, particularly extremely high rates of breast cancer that scientific literature connects with environmental exposures. I was researching and writing about the precautionary principle, a critique of the responsibilization of women for their breast cancers, of the barriers in governance and disproportionate power relations that left women at risk, and the problem of environmental justice. I then found myself working with a team of researchers examining the protections for healthcare workers when research was already documenting the science of airborne transmission, but which was being ignored by policymakers. The similarities between what the women workers at the bridge told me about barriers to protection and what healthcare workers were facing in healthcare in that system were striking. I applied the principles and concepts from my breast cancer research to the unfolding of the pandemic, contributing to the public conversations about the precautionary principle, collective responsibilities for health, and the flaw of personal responsibility as a public health strategy. These discussions are still very much needed today. They are needed because we know that home, family, neighborhoods, workplaces, schools, community, provincial, national, and global governance, and power relations, inequalities, and social determinants of health all interact to produce environmental health risks. The systemic contributions to the risks and impacts of COVID-19 and the messages that have surrounded the response to the virus are not unlike the systemic, social, cultural, and political conditions for other environmental health illnesses, including those related to air pollution, toxic substances, and environmental racism. When you look at the systems and the structures and economic and political influences on health, it's clear that we cannot look at health without looking at inequalities, power, and control. To address environmental health problems, including COVID-19, we must work for environmental justice. In January 2021, just weeks before I was to defend my dissertation, I received a phone call from one of the women in my study. She was calling to tell me she had been diagnosed with breast cancer a second time and had just undergone a mastectomy of the breast she had previously had lumpectomied. She told me she planned to have her other breast removed for fear of another diagnosis. She said that since we had last spoke, 2 other co-workers at the Ambassador Bridge border crossing had been diagnosed with breast cancer and another had died of the disease. It was devastating news. For so long, the stories of the women at the bridge in my study occupied my thoughts. The pandemic had shifted my focus to some extent, but when I heard this woman's voice, the importance of the research in how it brought out the problem of control over environmental risks for breast cancer was foregrounded. Just weeks after my defense, I came to work for the Canadian Association of Physicians for the Environment, where I put my knowledge of the interconnection of environments and health into action, advocating for improved legislation, regulation, policy, and practice as it relates to exposures in our air, water, soil, homes, workplaces, and communities for the protection of health, the prevention of illness, and the pursuit of environmental justice. So let's begin with a definition of environmental justice that's widely used today. The U.S. Environmental Protection Agency defines it as the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws. While there is environmental justice work in Canada, we have much more to do in law, policy, and practice to address the climate crisis, environmental racism, gaps in protection for Indigenous peoples, and ensuring the right to a healthy environment is enshrined for all, a right that Canada is lagging behind 160 other countries on. As we continue to confront COVID-19, advocacy for virus and harm prevention in an environmental justice framework can be beneficial. Support of that argument is found in some of the key principles that were first outlined by delegates to the first National People of Color of Environmental Leadership Summit held in 1991 in Washington, D.C. Principle number 2 demands that public policy be based on mutual respect and justice for all peoples, free from any form of discrimination or bias. Number 8 affirms that the rights of all workers to a safe and healthy work environment without being forced to choose between an unsafe livelihood and unemployment. Number 9, protects the rights of victims of environmental injustice to receive full compensation and reparations for damages, as well as quality health care. And number 10, considers governmental acts of environmental injustice a violation of international law, the Universal Declaration on Human Rights, and the United Nations Convention on Genocide. These principles have served as defining pieces of the movement for environmental justice and are relevant to COVID-19. So let's move to the example of healthcare workers. I researched and advocated for airborne protections from the SARS-CoV-2 virus starting in spring 2020 as part of a team analyzing healthcare worker testimonies of the conditions and protections in the face of COVID-19. We have a peer-reviewed publication on this research and other publications. The media initially reported the pandemic was an unprecedented event. However, we argued that casting this crisis as exceptional narrowed the focus. While the virus that causes COVID-19 was novel, the lack of preparedness and inadequate protection for healthcare workers was an old story. In many ways, it was an escalation of the ongoing failure of health and safety regulatory oversight, and it underscored chronic underfunding and increasing privatization in the healthcare sector. This is also an environmental justice problem. The politics and power relations in the workplace emerged as critical issues for healthcare workers, leading to psychological distress, the inadequacy of protection against an airborne virus, inconsistencies in policy, government failings, and barriers to achieving needed changes. Healthcare workers described feeling powerless as individuals and at odds with their employers and governments. In Canada, most healthcare workers are women, and many are recent immigrants or racialized. And in the early months, they represented a substantial proportion of COVID-19 healthcare worker cases. We later joined with researchers across the globe whose research had similar findings. The healthcare workforce's studies were predominantly female and significantly racialized. The workers included doctors, nurses, specialist technicians and professionals, aides, housekeeping staff, food services, and more. Their workplaces are hierarchical, and healthcare workers who spoke up for themselves or the people they cared for reported that they faced threat, reprisal, and derision. We collaborated on an international public statement with 7 calls to action to address infection, death, overwork, and stress of healthcare workers worldwide, starting with the assertion that governments must acknowledge that airborne particles transmit SARS-CoV-2, the virus that causes COVID-19, and that they revise guidelines accordingly and ensure accountability and strict regulatory enforcement. We finished with the demand that the report of the SARS Commission in Canada be used as a roadmap, including its calls to respect the precautionary principle, involve the workforce in decision-making, and prepare well in advance of future pandemics. The Ontario government recently stopped reporting the numbers of healthcare workers who have contracted COVID at work. However, estimates now suggest that 1,500 healthcare workers are falling ill each week at work. And a news headline today pointed to soaring infections, canceling surgeries, and redeploying nurses, underlining the ongoing spread of the COVID-19 virus and lack of adequate protection for healthcare workers and the public. Dr. Michelle Ananda Raja, a physician in Melbourne, Australia, who was one of our international collaborators, powerfully asserted that the WHO's denial of airborne spread of the virus has given governments an excuse to deny healthcare workers appropriate protection across the world. It needs to be called out because this is not going to be the only pandemic we face in our lifetime. For environmental justice, her message is critical. Next, let's connect air pollution with COVID-19. Some of this information comes from a report we just released yesterday at CAPE that reports on the health impacts of traffic-related air pollution. Research suggests causal associations between air pollution exposure and reduced lung function, asthma, respiratory diseases, cardiovascular diseases, neurological impacts, pregnancy-related outcomes, including congenital abnormalities, infertility, and eclampsia, cancers, diabetes, obesity, dermatological outcomes, and elevated mortality rates. Air pollution and environmental inequality are also related. The health risks associated with air pollution are disproportionately experienced in communities with higher levels of air pollution which are often also communities where racialized, Indigenous, and poor people live. Research shows that air pollution increases COVID-19 infection, transmission, and the risk of COVID-19 related mortality. Substantial reductions in transportation-related air pollutants were realized during the early months of the pandemic due to implementing restrictions and lockdowns targeted at transportation and travel, demonstrating the capacity for society to implement effective public health and policy changes, and the promise of working for policies and laws that can address environmental justice. As these examples of healthcare work and air pollution suggest, the COVID-19 crisis has made more visible and exacerbated links between racism, poverty, and health, while providing opportunities to enact change for environmental justice. Thinking about COVID-19 as an environmental justice problem begs us to recognize the nestedness of health, as is captured in the ecological model pictured here. It illustrates that health is not simply an outcome of behaviors and choices, but that all of our environments interact to produce risk or promote health. We can also think about this model as the social determinants of health, or public health, which also informs the justice elements inherent in health. Ecological models are concerned with the processes and conditions that govern the lifelong course of human development in the actual environments in which human beings live, and seek to account for the dynamic interplay between individual level factors and social, political, and economic factors of the systems in the environment through the life course. The omission of airborne science in messaging about COVID-19 and the corresponding inadequate protective and preventive action in our communities, public spaces, workplaces, and education settings are environmental justice issues. And they are problems of governance, politics, and the complexity of our socio-ecological environments as they relate to health. Focusing on preventing COVID-19 through individual choice and personal risk assessments ignores the nestedness of health and the fact that we don't all share equal access to the tools needed to prevent COVID-19 and disproportionate exposures and inequitable conditions faced by some populations. The ecological model makes evident that systemic changes and structural contributions such as policy, legislation, and practices in our work environments and communities are all spaces where interventions for public health and prevention are tools for social and environmental justice. Several critical lessons that emerge out of the pandemic are evident through the lens of environmental justice. Lesson number 1, first, do no harm. So much harm has been done in the pandemic that could have been prevented through health promotion and harm prevention. But for reasons of politics and failed governance, the harmful impacts of the COVID-19 pandemic have been wide-reaching. In the spirit of doing no harm and seeing the interconnectedness of health and environments, addressing environmental and occupational health threats is also action for environmental justice. Lesson number 2, we are all connected. The COVID-19 pandemic illustrates the intensity and complexity of our interconnectedness, not only to each other, but to our environments. The environment influences virus transmission among people, whether healthcare workers denied adequate respirators, seniors lacking protections in long-term care homes, racialized communities where many are unprotected essential workers, or children in schools without proper ventilation. Understanding the role of environmental conditions and related policy in the spread of COVID-19 is as important as other environmental health threats, such as the climate emergency, toxic exposures, and environmental racism. Lesson number 3, apply the precautionary principle. A critical lesson of the COVID-19 pandemic is the need to apply the precautionary principle. Sadly, it is a lesson we continue to fail to learn, and with deadly consequences. The SARS outbreak of 2003 provided a roadmap for dealing with future outbreaks, and a key recommendation to emerge was to implement the precautionary principle, which is meant to represent the public in all decisions made under scientific uncertainty. Where there is substantial scientific uncertainty about the risks and benefits of a proposed activity, policy decisions should be made to err on the side of caution with respect to the environment and the health of the public. Furthermore, when an activity raises threats of harm to human health or the environment, precautionary measures should be taken even if some cause and effect relationships are not fully established scientifically. The precautionary principle would be fundamental to environmental justice work. Lesson number 4, risk management and hazard prevention are different paradigms. COVID-19 responses have primarily centered on managing risk and keeping cases at controllable levels by the healthcare system. While this approach may be effective in maintaining cases below certain thresholds, it is fundamentally a different strategy from broadly preventing the hazard of airborne exposure and infection through things like ventilation, filtration, high-level personal protective equipment, and other preventive tools. Engineering controls, regulations, and protection policies are the responsibility of various levels of government. Individual behaviors, however, tend to be foregrounded in health messaging. But with most health issues, no single level strategy works, and governments have important roles in prevention. The adoption of a hazard prevention paradigm by governments would prevent future cases of COVID-19 and prevent other respiratory illnesses, as well as cancers, reproductive harms, and more. Lesson number 5, prevention is a shared responsibility of individuals and governments. Laws and policies that make health and justice the priority, as opposed to prioritizing economic considerations and making individuals responsible, lead to governing very differently and with better environmental health outcomes. The scientific evidence of airborne transmission of the virus that causes COVID-19 led to epidemiologist Dr. David Fisman's statement that air is the new poop. Just as clean water became a public health and political priority, with the discovery of waterborne diseases such as cholera, typhoid, and more, COVID-19 begs us to take concerted action to clean the air, indoors and outdoors, for all environmental health hazards. With the scientific knowledge of the causes and conditions in our environments that lead to ill health and disproportionate impacts on specific populations, plans for preventive action become possible, and so too does the realization of environmental justice. As sociologist and professor in the Global Peace and Social Justice Program at McMaster University, Dr. Ingrid Waldron said, environmental policies are created by members of the elite, mostly white people, who hold perceptions about who matters and who does not matter. Building on Dr. Waldron's words, it's time for environmental policies, whether for airborne transmission of COVID-19, environmental racism, exposure to toxins, or climate change mitigation, that will prevent ill health and uphold the right to a healthy environment for all, and that are created by those who will work through a lens of environmental justice. Thank you.
Thank you, Jane. That was very powerful and a lot to think about. We don't have any questions listed right now, but I encourage people to put them in the chat or to raise your hand. But I was wondering, I guess, just in reflecting on all that's gone on and all that we've learned and how we consider ourselves to still be struggling, I think, in the pandemic fight, just wondering about examples of success stories, maybe with a small s, or solutions that you think, and what can make a difference, I guess. I think you were actually the person that had mentioned to me the concept of local solutions. So I wondered, and making things meaningful for people on their own, in their own level, how that helps engage in things. So I just wondered if you had any examples you could think of, or just success stories we know there are, for instance, long-term care facilities where things have all gone well, and we know there are many where they haven't gone as well. So just any insight into that, or what you think can make a difference?
Yeah, that's a great question. And I do think it's really important to count our successes. And sometimes successes are hard to measure, because I think oftentimes when we're talking about trying to influence change, and we're shifting paradigms and influencing discourses, they're not measurable. But I would have to say that, I've often looked in the last couple of years at the conversations and the sharing of information and the advocacy for public health by so many different people from so many different disciplines. And I've seen the frustration by so many that the advocacy hasn't resulted in the outcomes they wanted or as quickly as they wanted. But I look at that and I often have to take a step back and look at how long the fight has been around issues of the climate crisis or exposure to toxins or environmental racism. These unfortunately are long fights because what we're talking about it's really a question of values and a question of politics, as I've said. So I honestly would count the success of the sheer volume of voices and the tenacity and the organization, at informal levels across disciplines of people collaborating and getting together and sharing their knowledge. I think that's one of the big successes that we can recognize out of the pandemic. I myself have learned so much from so many different people, even just on social media and webinars like this. And so I think it's been a tremendous opportunity and a success to see the interdisciplinary nature of addressing public health problems of governance, and of the need for community organizing. I know we have a lot of failures that we can see, and I think we're continuing to fail on a lot of levels. And as a mother, for example, of 2 children who I now, I have them at home. I live in a community where we have the highest ever levels of the virus in our wastewater signals, and people aren't wearing masks. So, but at the same time, what I see is an ongoing conversation and demands from members of the community to see governors at the level of school boards or the health unit or municipalities of the province. So I think really we've seen the power of people's voices. It's just that our governors, our decision makers aren't necessarily responding to that. So I do think that's a success. And maybe that's kind of a, not, as I said to start, not measurable, but I think it's there and I think it's important.
Yeah, I think all that I would agree with, and although I have wondered, and I think that's actually a segue into Colin's talk about is there an echo chamber to some extent? So we're engaged with whom we're engaged, and we listen, and that reinforces, and we think, oh, this is exciting, and I do think that the level of interdisciplinary and even international engagement over social media that people like Trish Greenhall at Oxford, who's a classic, to put something out there to say, I want to write a paper on such and such, and I need 10 different people that I haven't published with before, and then 2 hours later it's, oh, we got a great crowd and we're off and running, kind of thing. I think that's amazing. And hopefully in the process, it does bring different perspectives and different voices, hopefully. But yeah, I think we also need to think about the voices that we're not hearing, and how do we engage them? I don't know if you have any thoughts on that before we switch to Colin, on how do we engage voices? Well, how do we recognize that our experience of social media isn't the only conversation, and how do we engage voices that aren't connected to social media? And I guess, how do we engage people who are in those local solution kind of groups? Do you have any thoughts on that before we?
Yeah, that's another great question, and it's something that I think, again, if I use my experience in the environmental health space and in occupational health space for some time, is that we often struggle working in silos. And I think, again, using the framework of environmental justice and the recognition of environmental racism and vulnerabilization of certain groups of people, I think we tend to want to think that our experience is the experience, and that somehow there are people who are not part of the conversation because they're not in conversation with us. And so I think we often need to step out and go into those other conversations as, solidarity work, and not drive the agenda, so to speak, but be willing to listen to, because I think there's a lot of action and activity and advocacy and awareness by people who are maybe not formally organized into, organizations or groups or connected in with the production of knowledge or the production of messages. But I think, being willing, as you say, to move outside the echo chamber and listen to the experiences, even if it's not documented in scientific literature, that the experiences of the communities on the ground and in their workplaces, in their schools, those voices, they need to be heard. And I think often they are ignored. And I think sometimes we presume that they're not present, that they don't exist, but I think they very much do. It's just a matter of us, recognizing and seeking out and being willing to listen and stand in solidarity and work together.
Thanks very much. We'll pick up the conversation later at the end. So